Good afternoon. My name is Dr. Bradfield.
Hello.
How are you feeling today?
Well, as of lately, I haven't been feeling that great.
Okay. Can you describe to me the symptoms of what you're feeling?
Well, to be honest, I'm not really sure what the problem is. Sometimes it's my head, sometimes it's my arms, sometimes it's my legs, and even my bowels.
Okay. Maybe elaborate a little bit more than that.
So lately I've been feeling very drowsy and tired with some spurts of dizziness. So I assumed I was just sick, but I've been starting to lose my vision, usually in one eye at a time. Other times I get prolonged double vision, and my eyes even start to hurt when they move. So at first I thought it was something in my eyes. Then my entire body started to feel weird. With tingling and sometimes numbness and weakness in my limbs on one side of my body at a time. This is when I started to get scared because I thought I was having a stroke.
Well, all those symptoms are so different, and it leads me to believe that there's something neurological going on. So could I ask you a couple more questions?
Of course.
Do you have any recent experiences in your speech being slurred?
No, not really.
Have you been experiencing sensations to something like electric shock, specifically in the neck?
Actually, yes. It's usually when I bend my neck forward, I feel that.
Okay. I have a suspicion of what your condition is, but I'd like to run some more tests before I make a firm diagnosis. I recommend a blood test just to rule out some various conditions and to make sure that your kidney is functioning fine and that your blood clots are regular.
Whatever you say, doctor. I just want to find out what's wrong with me. So the primary symptoms of MS are a direct result of the demyelination and can result in the following, which are weakness, numbness, tremors, loss of vision, which the patient explained, and pain, paralysis, loss of balance, and bladder and bowel dysfunction. So our patient here only said some of the symptoms, but there are definitely more to consider. And secondary symptoms are complications that arise as a result of the primary symptoms. So an example of that is paralysis can lead to bed sores, bladder dysfunction can cause repeated urinary tract infections, and inactivity can result in weakness, poor postural alignment, trunk control, muscle imbalances. And then we have the tertiary symptoms, which is the social, vocational, and psychological complications due to MS. So a person who becomes unable to walk or drive may lose his or her livelihood. And we see a lot of depression with MS because it is such a debilitating nervous. In this case scenario, a blood test would be the first round to figure out what is wrong with the patient and to rule out other diseases. So what a blood test would do is it tests for biomarkers associated with MS, and it would also help to diagnose the disease in the future and rule out other diseases and look for markers associated with cancer so that the patient and the doctor can start to rule out and figure out what disease that the patient may have.
Hey, how you doing? It's good to see you again.
Good to see you too.
How are you doing, actually?
I'm as good as I can be. How are you?
I'm good. Let's go over your blood results. The good news is that we've ruled out most of the diseases that your symptoms are related to. The bad news is that we are going to have to run a couple more tests before we discern your conditions.
How did the blood tests rule out all those other possible diseases?
Well, a couple blood tests detect markers that are specific to certain diseases such as cancer, diabetes. We test for proteins or tumor cells that may be circulating in your blood. Now the next step would be ordering an MRI to look for any anomalies in your brain or your spinal cord.
An MRI, or a magnetic resonance imaging, is a type of scan that uses strong magnetic fields and radio waves to produce detailed images of inside the body. In this case, we would be looking at the brain of the patient, looking for lesions. As you can see, the white arrows in this picture are pointing to lesions in the brain that indicate that the disease is in an active phase.
Well, Miss Concannon, I have the results of your MRI. Regrettably, we have found multiple lesions in your brain. However, we cannot be sure that these are infectious, benign, or anything else before we run extra tests. We do know, however, that this is not cancer or any other type of tumor.
So what's the plan now?
I don't think you want to hear this, but we still need more tests to correctly diagnose you. This should be the last one, but I don't want to get your hopes up. I'm recommending a spinal tap so we can complete that here. The results should be back within a couple of months.
A spinal tap, also known as a lumbar puncture, is a medical procedure in which a needle is inserted into the spinal canal. It's most commonly used to collect cerebrospinal fluid, also known as CSF, for diagnostic testing. The main reason for a spinal tap would be to help diagnose diseases of the central nervous system, including the brain and spine. Examples of these include meningitis, subarachnoid hemorrhages, and multiple sclerosis. So what a spinal tap would show is abnormalities in the antibodies. So you're going to rule out infections. If you already do know that you're looking for MS, you want to make sure that there are no severe infections happening in the body if MS is in an active stage. So you'd use a spinal tap to confirm your results and also look for diseases.
So I've completed spinal tap results. Now I would like for you to keep an open mind on what I'm about to say because you dealing with this condition and how we proceed from here is all up to you. Your results confirm that you have multiple sclerosis, which is an autoimmune disease in which your body attacks its own nervous system.
Wait, is this like AIDS or something? Am I gonna die?
No, you're not going to die anytime soon from MS. However, this is not going to be an easy road. To answer your other question, no, it's not like AIDS. In multiple sclerosis, the autoimmune system attacks its own nerve cells and damages myelin as well as its nerve fibers. Unlike AIDS, in which the immune system has been too compromised and weakened to defend itself against other infections.
Myelin? What's that?
Well, to detail it out for you, the nervous system is composed of nerve cells. These neurons have different parts to them. The dendrites are stimulated by other cells in the form of neurotransmitters. The cell body contains the nucleus and performs the basic functions of the cell, and the axons, which send information to other neurons through neurotransmitters. Now, some cells in the central nervous system are coated in a substance called myelin, which increases the speed at which impulses are conducted through the nervous system. Multiple sclerosis is a disease that attacks the central nervous system and can damage these myelin sheaths around the neurons. Because of this damage to the myelin, MS can weaken your muscles, damage your coordination, and in the worst cases cause paralysis. Now, everyone diagnosed with MS takes different paths and treatments depending on the severity and location of the damage. Relapses in the disease or attacks that can include loss of vision and severe weakness can be followed by periods of partial or complete recovery called remissions. Sadly, there is no cure for MS.
So what do we do? Just wait for me to become paralyzed and die?
Of course not. Millions of people suffer from multiple sclerosis and live close to normal lives. However, that depends on how diligent you are with your treatment. I will have to warn you though, no treatment is forever and your condition may worsen rapidly without a sign. Now, the medication I prescribed for you will be oral and injectables. These medications will not treat the disease, but will reduce the number of relapses, delay the progression of disability, and limit new disease activity and help with symptoms.
Okay. Thank you, doctor. So currently there is no cure for MS, but what we do have is treatments to lessen the symptoms. So a lot of the treatments that are common are injectable therapies, such as beta interferons and corticosteroids to help eliminate some of the symptoms. And then we have liquid therapies and pill therapies as well to help combat the disease.